In terms of treatment and diagnosis, what are the latest advancements when it comes to breast cancer?
Breast cancer care in 2007 is a much more complicated approach than it was even 20 years ago. Breast cancer used to be called a surgical disease. There was a surgical treatment for breast cancer, such as appendicitis is today. If you have appendicitis, you need a surgeon, anesthesiologist, a couple of good nurses, and you don't need a whole team of physicians. And breast cancer care used to be like that. Fortunately now, surgical care of breast cancer is only a part of a multidisciplinary approach. The surgical oncologist is very important, the medical oncologist is very important, and the radiation oncologist is very important. So you really need a team of physicians and support personnel to help educate a woman about what her options are, which is very important with breast cancer, help her get second opinions, and then help her complete her treatment. Diagnosis of breast cancer, just as treatment of breast cancer, has become much more complicated, which is wonderful. It also is a little bit taxing sometimes for patients because mammograms, very, very important. Critical screening tool. Digital mammography has come into the front. It is easier on the patient. It is less radiation. Much nicer pictures to look at. We pick up a lot more cancers with digital mammography. Ultrasound remains important, and MRI of the breast has become a very important imaging tool as well. PET scan and PET CT scans are gaining in importance. We haven't used them for quite as long, but we're getting a lot more information now as we use them more about how they can be helpful. So the screening for breast cancer has become more complicated. One part of screening that has not gone away is the importance of the physical breast exam. Very, very important to have the physician do a breast exam at least once a year in every woman who at least over 35. We like it to start earlier if possible so the patient and the physician gets used to the characteristics of the individual breast and things like that. But no imaging modality can replace a good physician breast exam.
Dr. Wilde, could you elaborate a little bit on the latest advancements in both breast cancer diagnosis and treatment?
Current treatment is a multidisciplinary approach. Surgery is still indicated in the majority of women who have a diagnosis of breast cancer. Very important to remember, it's not always mastectomy. Sometimes it is, and sometimes that's the best thing. Sometimes that's the best thing for that patient. But I think the fear that every woman who has breast cancer diagnosis is going to have a mastectomy is unfounded. Surgery remains important. Radiation, very, very important. There are different types of radiation now that we can give. We can give whole breast radiation. We can give a more limited area of the breast radiation with very good results also. And then, of course, the medical oncology aspect of it is very, very important. These are the chemotherapeutic agents, the oral agents, pills that women can take. Incredible advances in the medical oncology arena recently. So when you put those three things together, surgery, radiation, and medication for breast cancer, our cure rate, not just treating for relief of symptoms and things, but the actual cure rate of breast cancer is very, very high, certainly the highest it's ever been. You know, you hear that we need to find the cure for breast cancer. We cure a lot of breast cancers. We cure most of some types of breast cancer. But we don't cure all breast cancer yet, and of course that is the worthy goal that we're all working towards.
Dr. Wilde, we know that the incidence of breast cancer has certainly increased in the last several decades. Some attribute that to our Western lifestyles. Can you elaborate on that?
We do know that breast cancers are being detected more frequently, and it may be, again, a reflection of people taking advantage of the screening modalities that we have now that we didn't have even in certainly in the 70s. Much more advanced imaging technology, a lot more knowledge about how breast cancer works, and therefore more knowledge about how we can find it even at a much smaller stage, earlier stage, smaller size. So I think we can attribute some of that increase certainly to increased detection due to the advances in technology.